And we are live.
Okay, terrific. We're back. This is Senate Health and Welfare again on our favorite date of January 13th, Friday. And we have with us Commissioner DeLaBriere of DEVA. And before we begin, I think we'll introduce ourselves. New committee and your first time in here this year, so great. Perfect. Go ahead.
Senator Dave Weeks, welcome, California.
Hello, Martina Murak Hewlett, and I live in Burlington, and I'm in the Chittenden Central District.
Nice to meet you. Ruth Hardy from the Addison District.
Terry Wings from the district.
And Jenny Lyons from Chittenden Southeast. Welcome.
Thank you, Madam Chair.
Why don't you introduce yourself for the record, and then we'd love to get kind of the ground floor on DEVA. We've had some really great testimony already from Nolan Langwell, and he has set you up very nicely.
Fantastic. Thank you, Nolan.
Yeah.
Well, thank you very much. For the record, Andrea DeLaBriere, Commissioner for the Department of Vermont Health Access. I'm very pleased to be with you today, and I have a PowerPoint to share to walk through some of the high-level work that DEVA does, how we fit into the Agency of Human Services, and our priorities for the year. There are many to unpack, but I'm hopeful that give you enough background so we can talk more in subsequent testimony opportunities. So I have my screen ready to share, if it will allow me. That's right. Okay. Is it up?
Yes.
Right, presentation. All right. Make sure I can read all the things that I need to read. Okay. So I thought I'd start with a little bit about our mission and values. The DEVA mission is to improve Vermonters' health and well-being by providing them with access to high-quality, cost-effective health care. We really do strive for this, and we know that when people have health insurance, they're more able to access the care they need, including, and sometimes especially, preventive care. We're fortunate in Vermont, the uninsured rate here is very low. The Vermont Households Health Insurance Survey in 2021 reported that 97% of Vermonters have health insurance, which I think is very significant. The last time I checked, we were second in the nation, Vermont, second in the nation in this. So a testimony to the work that we do and you all do for the state and for Vermonters. Our core values include the transparency, everyday integrity, and service. A little bit about what we do. DEVA is one of 6 departments in the Agency of Human Services, and we play a really integral role across the agency. We administrate the Medicaid program, but we don't actually oversee the individual programs for each department. So it is really under the purview of mental health or substance use. In that case, it's Department of Health. But we do work very closely with all of the departments in the agency, and we do a lot of work in the areas of payment reform, policy work, and those kinds of things. So it's a big part of what we do. We also have help Vermonters access health insurance through the Health Insurance Exchange, which we also call Vermont Health Connect. And we know that part of you can access Medicaid through Vermont Health Connect as well, but we help Vermonters access healthcare services. We also pay healthcare providers to deliver care to Medicaid members. And then we strive to spend taxpayer dollars wisely by running an efficient department. Please stop me if you have any questions as we go along. A little bit about our priorities and how they connect to our mission. Our first one is really advancing value-based payments. This is an area where Vermont has been an innovator in this space, and really essentially what that means is moving away from the fee-for-service, such as tests and procedures and based on volume, and moving toward more value-based care where we're linking it to quality and cost of care. So there's been a shift over time. The all-payer model was a significant driver of that. And we are still very much in the phase of provider adoption for this concept, and it works well for some providers and not so great for others. And so there's a balance of, and it is voluntary at this point if people want to move away from fee-for-service into more value-based payment arrangements, but we are seeing more and more of those. And it has proven to be over the last several years, and particularly noticed throughout the pandemic, where providers have a reliable payment on a regular cadence so that they were able to sustain their operations. And that's been a really important spotlight during the pandemic, where they wouldn't have had that with the ups and downs of fee-for-service drivers. Does that make sense? So there's a lot on this slide, but that's basically boiled down to.
Yeah, but your last comment is really important, because fee-for-service during COVID, so many people were not going to get care.
Right.
And so provider stabilization, their financial stabilization dropped.
It did.
But fee-for-service kept them whole and allowed for patients to access as needed. Well, there was stabilization funds too, and it's the whole lot.
Right, I mean, value-based payments were the predictable payments, if they had those arrangements. We saw drops in tests, drops in procedures, drops in office visits, which are if it's billed fee for service, significantly affecting the finances of a small practice, for example.
Yeah.
So that's where, in the case of high-tech nursing, we have a program where we have developed some value-based payments for those, and it's essentially the cost of care. That has really been helpful for them. It's netting a lot of positive reviews, even though it's a smaller program. There are folks that are complicated, have complex needs, and we can offer them through a value-based payment arrangement more predictable, reliable payments regardless of the cases.
So for those payments, those value-based payments, do you provide them directly, or do all of those payments go through the county care organization?
We actually have arrangements, like, for example, with high-tech nursing, where they're not attributed to the ACO at all. So we do have arrangements where we reimburse. We just have a mechanism.
Directly from DIVA through to the
Medicaid.
Yeah,
provider?
I think that's a good question.
Yep.
That's a great question, because as we look at the ACO ultimately,
Sure.
then the question is, do you need an ACO to have an all-payer model? And when we get to all-payer model, we'll ask that question again.
Yes.
Yes or no? We need something.
Correct. Yes. Thank you. Great questions. So modernizing information technology infrastructure, this is a very significant area for the department, but it's also very complex and takes a long time to come to fruition for some of these initiatives. But really, our goal is to make sure that Vermonters have the ability to sign up for health insurance in an easier, accessible way, access to their health insurance. And then we need the ability to have the technology to appropriately pay providers, to your earlier point. And that's modernizing that. We have many disparate systems across the state. And so looking at that from our lens, the DIVA lens, how can we use some existing technology to better serve Vermonters while bringing in new technology that will not go out of date or be antiquated within a year or two after implementation. So this is an ongoing need, an ongoing goal of ours is to improve that over time.
Alignment.
Oh, yeah, it's a lot. So, but very, very important. And I think Vermonters will benefit from that. Our next priority is really about operational performance improvement. We have many scorecards, public-facing scorecards, which really kind of share metrics about how we're doing with some of our important work. Not all of it's out there, but it is, really one of the things that we use to drive our decisions in the department. Where we go, do we need to adjust? How are we doing? And where we would need to potentially change our policy about something in consultation with stakeholders. But it really helps us drive a higher value of quality. So far, so good anyway, but we're refreshing some of those right now, and it continues to be a work in progress. when we look ahead, the work of DIVA is very diverse and it's very exciting, but it's also a high volume of activity going on in the department. Medicaid's a big payer for the state. It's about a third of the agency spend, actually, in terms of budget. In terms of our looking forward to our priorities, open enrollment, which is happening now and actually ending on the 15th, which is 2 days from now. We have had a successful open enrollment period. It's been interesting. We have not seen as many folks enroll in qualified health plans. And that's really where you have the time frame to use Vermont Health Connect and enroll in new health insurance. We've seen about 2,600 new enrollments, which is down a little bit from previous year. And we think that's primarily because there are so many folks on Medicaid right now. And I'll get to that bucket soon about the unwind.
So even, excuse me,
Yeah, go ahead.
even with the increased subsidies from the federal government, you're not seeing an increase in enrollment?
Not yet.
Not yet. What do you mean? You think
Well, when we
when
get into unwind,
reauthorization, you think they're gonna,
I do, and I'm happy to expand more on that when we get to the yellow block.
Okay.
I think it's relative to,
Yeah, I keep asking the commission or the secretary about this, so I'm glad you're gonna cover the unwinding. Yeah.
perfect. Okay, great, yeah, I'm happy to expand on that. I talked about this earlier, the modernization of technology is important to keep a pace with what Vermonters actually need. Advancing values-based payments, which I also talked about as another priority. The Global Commitment to Health Waiver, which is also known as the 1115 waiver, offers the framework for how we administrate the Medicaid program. Have you had a presentation yet?
Next week.
Okay, perfect. So I'm going to let the experts speak to that. Ashley Berliner is the DIVA policy director, and Nolan, of course, will do a deep dive into we landed in a very favorable position in July. We're really happy, and it was a tremendous body of work for the team to accomplish. So I'll let them speak to the details about that. And in terms of staff workforce recruitment and retention, it's an ongoing struggle, ongoing need to find new folks to work for the department, keep new folks working for the department, and every sector is experiencing the same amount of pressure. So I'm laser focused on, our staff trying to balance their workloads as much as possible, preparing for some really large challenges with the unwind for the public health emergency, which is coming along in a few months. And, how do we really keep our staff and keep them serving Vermonters, which is, the goal here is how we accomplish our priorities. So moving on to the topic, lots of folks are really focused on the unwind. It's really called the unwind from the public health emergency because during this time, since March of 2020, the federal government has required there be continuous healthcare coverage for anyone on Medicaid. And in return for the continuous healthcare coverage, states have the choice to either do that or not do that, opt in or opt out. But if they were opting in, which we did, Vermont did, the agency would receive an enhanced FMAP. Right. So I'm not very great with
Nolan
that.
did mention it, was 6.25, right? We had, and it's there still, but maybe you can help us understand.
Well, we talked, I said that, I tried them and said we'll go into the weeds of the line next week.
Yes. Yeah, I'll let you do the weed part because, but it has benefited the state and it has kept folks insured, which really was, primary driver in all this, is making sure people don't go without health insurance. So that said, as a result, fast forward to today, and we have an additional 36,765-ish Medicaid members than we had prior to the pandemic. Great that people have insurance, but it does put additional pressures on the system. And go ahead.
What was that number again?
About 36,765, right in that vicinity. additional members than pre-pandemic. So we have about almost 208,000 members right now on Medicaid.
That was on hold, sorry.
This is that churn disruption that I'm talking about.
Right, so we have not redetermined eligibility during this time due to the reasons I stated previously. And we have learned, as of the passage of the omnibus bill recently through Congress, that they're decoupling the redetermining eligibility requirement from the public health emergency. So what that means is, beginning in April, we will start to redetermine all 208,000 Vermonters to find out whether or not they still qualify for Medicaid. You see where I was going with the staff?
Yeah.
Uh-huh. Yeah, it's a big challenge.
Yes, it is.
We will have 12 to 14 months to accomplish it, and it will be a very thoughtful pace per month, a number of enrollees that will be redetermining each month. Go ahead.
No, I understand. This is like a Herculean task. There's no question about it. And obviously there'll be some prioritization about who's authorized first. And
Exactly.
I just can't imagine, but it would be helpful for us, particularly me, because I'm going to be down the hall as well, to understand what the workforce needs are as you're doing that and what the costs are going to be.
Okay, thank you for that.
Yeah.
Yes, our goal is, everyone is going to have to contribute to accomplish this. We know that we have. some
Yeah, and there was
things to do.
reallocation of staff during the pandemic. Is that going to happen here?
It probably likely will have to happen in order to meet the need. There are also a lot of other initiatives going on at the same time that we need to be able to balance. And so we are, we've been planning for this for a while and just trying to figure out, and either way, our staff is incredibly talented and dedicated. It's difficult to hire a contractor to do this kind of work because it's very specific. And also our staff's tired. It's a couple years, as everybody is, right? There's a lot of stress. So we're kind of working through initial plans on the prioritization and deprioritization of other groups of folks. So, for example, individuals that we know may not qualify for Medicaid due to financial reasons would likely qualify for a qualified health plan with a subsidy, to your earlier point. So we would prioritize that group as one of the first ones that we begin to redetermine eligibility for. And fortunately in Vermont, we have Medicaid in the same department as the health insurance exchange. So it's a nice bridge to that next chapter. And then in terms of deprioritization, we know that the postpartum coverage expanded last year. Thank you very much. And we would essentially make sure that individuals that may have a child during this unwind period would not be disenrolled and allow them to stay on so that they could then have more health insurance coverage down the road and hopefully transition into a different kind of plan after that, if that makes sense. So those are just two examples of groups we would prioritize and groups we would not.
When you're, the people who would qualify for the qualified health plans and potentially or probably a subsidy, are those plans, do they provide equivalent type coverage to what someone would get on the Medicaid?
On Medicaid, I think it depends on the payer. So it's Blue Cross Blue Shield, Cigna. I think there are also varying levels. So there's silver, gold, platinum.
Would
It
you,
really kind of depends.
would your navigators or whatever they're called at this point help them figure out the best plan so that they are not gonna have a lower coverage?
Absolutely. And the beauty of it is we call them assisters.
Assisters, yeah.
navigators, assisters, and they are embedded in a lot of communities across the state of Vermont. I attended a conference in the fall where we brought them all together and provided an update on where we are, what the plan is. And it was really inspiring for me to see that they are so engaged in this, and they are the ones that are really gonna work with
Boots on the
boots on
ground.
the ground to help them navigate a very complex environment,
Mhm.
frankly. But the subsidies are a result of the American Rescue Plan Act that have been extended for 3 years. So that I think is I'm glad we're emerging from the pandemic, but this is probably the best time to be able to kind of offer that bridge to the next, hopefully qualified health plan and move on from Medicaid. Does that make sense?
Well, let's
Yeah.
hope that the economic recovery is continues consistent with that plan.
Absolutely. So any other questions on the online right now?
And is this, to Senator Lyons' point about, do you have a budget request in for any additional resources you may need?
So right now, we're going through BAA process. We don't have any information in the BAA. And then there'll be more information in the FY '24 budget request.
Next Friday.
This should be next Friday, I believe, yeah. We should have more information about that.
Good question.
Excellent question. So, and then the last bucket is really about provider sustainability, which is, we have done a lot of work with extraordinary financial relief requests and, other ways that we could help sustain providers and contribute to that where we can with either COVID relief funds or otherwise. And it's been a busy time, and I know that a lot of, between the cost for staffing, the cost for supplies, the cost of inflation, those kinds of factors have really driven up what it takes to provide quality care. So it's something we're worried about and want to maintain our networks for access to members. Okay, just some of the topics. If you're not as familiar, Green Mountain Care is also known as Medicaid. This can be confusing, and it was confusing for me. And what we're trying to do right now is a little bit of research around brand alignment so that there's a little less confusion. That people know that Green Mountain Care is the same as Medicaid. Vermont Health Connect is a DVA unit. And we wanted to make sure that people have access to health insurance through the marketplace. I won't read this whole list, but it's all things that I've already spoken about. Those are the things that we can help with, and probably more.
And just FYI, for folks here around the table, we are gonna do the deeper dive with Nolan and Ashley Berliner next week. And then we'll also be looking at all payer models so we can understand how the calculations are made for the payment within payment reform. And then also healthcare reform generally. So there's a lot that we're going to cover that'll all start to come together. And hopefully will start to come together.
Use the terms BAA.
Yeah, sorry, budget adjustment.
Okay.
Sorry about that. I'm the one that complains about acronyms all the time, and I just used it, so.
Well, you're clean of acronyms in this presentation. Really great. Only Diva.
Only DIVA, which is lovingly Diva. I think there's anything else, other than the leadership team, most of, myself, we're all available. Deputy Commissioner Strumolo really is responsible for the enrollment and eligibility side of the house and policy as well. And then Deputy Commissioner Hoffman is really on the clinical side of things, looking at quality and any sort of clinical integrity guidelines. And then Alicia Cooper, she is the Director of Managed Care Operations. So any information related to rates, methodologies, what have you, value-based payments, her teams would be very much steeped in that. And then Alicia Cooper, I already said Alicia, but Patrick Rooney is our Chief Financial Officer at DIVA. He has a big job, $1 billion budgets, it's a lot. And then Ginger Irish is our legislative liaison. You may or may not have interacted with her. She's the newest member of our team and has been doing a great job.
She's terrific. That's very good. Yeah. And she has a lot of experience and knowledge, so she covers
Exactly.
more than just liaison.
That's a fact.
You said your sisters are in the communities, where would they be located?
They're generally associated with practices, and I can get you a map. I can share a map with you of the areas.
So send it to Alex.
Okay, I'll send it to Alex, and that would probably be the most helpful for you, because I don't remember where they are exactly on my list, but they're embedded with.
But they're not in with the municipality, they're in with the provider.
I think in some cases they are, but I'll share the list with you, and then I won't
Okay.
speak out of my lane.
Questions? Commissioner, all set? This has been a terrific introduction. It does jive very well with what we've been hearing from Nolan and others, and we're going to continue in that direction. I'm sure this isn't the first time we'll be in the committee. But the question about resource needs is significant, and whether or not any of the federal dollars coming to us are going to cover that extra workforce needs that you have, or how that's going to sugar off, I think is going to be pretty critical to a smooth transition. You know that.
I agree, yeah,
Yeah.
I agree, it's a lot. So thank you for your support.
Thank you.
Thank you.
Thank you very
I think we're good here.
All
This
right.
is great, very good.
Wonderful.
We're gonna take take a 5-minute break, and then we're gonna come back with our committee presentation from Katie and Ameren, our ledge council. They may go back to, I think they might go back. Oh, they're here now, so let's not take the break. But do you need, if you need a break, go right ahead. Yeah, good, all right, they're both here. Thank you very much, Commissioner.
Thank you very much, Madam Chair.
Welcome
Nice to
to
meet
the
you.
committee.
See you all.
Have a nice weekend and drive carefully.
You as well, yes, it's pretty sloppy out there.
Is it? One is not frozen yet.
Not yet,
Yeah, I know.
soon.
Thank you, Nolan.
It was very good.
Yeah, you did. So Katie and Jen, welcome. So did you, I'm gonna leave it with you as to whether or not you'd like to continue with the slides from yesterday on the bills. I think we're at 167. I think we're getting close to the end. You want to do that first? I see shaking heads, yes. So that, I think that's probably the better of the two things to do, and that reports can happen. If they happen today, we could begin them and then continue next week or another time. We have lots of places where we can put reports in. Okay,
Usually.
so welcome.
Thank you.
See you, yes.
Can you hear me okay?
Yes,
Great. Ameren, do you want me to pull up the slides? Is that easiest for you?
I have them up already. I
You
just have
have
to
them,
start
okay.
sharing. I do.
Okay, Ameren's ready. Great.
Oh, I have not, I'm not able to share.
Now you should be.
Okay. There we go.
so if we want these slides, we'd go back to yesterday.
I put them on for today as
Oh, you
well.
did, okay.
Okay. For the record, Ameren Aberdaily Legislative Council, can you see my screen?
Yes.
Perfect. All right. So starting off with Act.
And how do you expand it and get rid of the, I know it's okay, but just way it is, you're fine.
Okay. Okay. Do you need me to make it the text larger?
It's
that-
good.
It's good. Okay. So first is Act 167. This is a two-pager because there's a lot in this act. This is an act relating to healthcare reform initiatives, data collection, and access to home and community-based services. So first, this act requires the Agency of Human Services, in collaboration with the Green Mountain Care Board, to develop a proposal for a subsequent all-payer model agreement with the federal government to secure Medicare's continued participation in multi-payer alternative payment models in Vermont. This act also directs the Green Mountain Care Board, in collaboration with the Agency of Human Services, to develop value-based payments for hospitals that will reduce inefficiencies, lower costs, improve population health outcomes, reduce health inequities, and increase access to essential services. There's also a direction to the Health Information Exchange HIE Steering Committee to include a data integration strategy in its 2023 strategic plan. And it directs the Department of Financial Regulation to explore the feasibility of requiring health insurers to access clinical data from the Health Information Exchange to support prior authorization requests. The Act specifies that Blueprint for Health initiatives must include quality improvement facilitation and other means of support quality improvement initiatives. So it's quite a broad range of topics in this bill. And then you'll see in the, sorry about that. In the second slide, so it also requires the Agency of Human Services to recommend the amounts by which health insurers and Medicaid should increase their per member per month monthly payments towards the shared costs of Blueprint services. And then also to provide an estimate of any necessary state funding for Medicaid's share of that increase. So you'll see later when we go through the reports, there is a report due back on this section, January 15th, 2023. And then the Act directs the Department of Disabilities, Aging, and Independent Living to convene a working group. This is about making recommendations on extending access to long-term home and community-based services to a broader cohort of Vermonters. Again, there's going to be a report back on this. And then the Act expresses legislative intent to reimburse Medicaid participating providers at 100% of Medicare rates, with first priority for primary care providers. So those are the high level on a very meaty bill.
So we will, and I think these reports are coming in pretty quickly, and we're going to want to hear from folks who've been working on these, I think, because these are really important next steps in whatever's happening in terms of healthcare reform. So we want to ensure that we get an update once those reports are in.
Okay, the next act is Act 150, an act relating to the Parent-Child Center Network. Just to sort of step back for a moment before we look at the actual language of the bill, there are a number of parent-child centers distributed throughout the state. They provide all types of services for children, for families. Some centers provide childcare, some do not, but all centers are able to connect families with services as may be necessary. So this bill creates a network of parent-child centers. I think they've probably seen themselves as a network for a long time, but this particular act sort of made it official in legislation. So the first thing it did, it defined what the network was. So the network is an agency of human services community partner composed of authorized parent-child centers that ensures accountability and collaboration among authorized parent-child centers. The other thing the act does is it really looks at how a new parent-child center would become designated and how funding is distributed through the network. So the next bullet, you'll see that this act amends the criteria that the Secretary of Human Services uses to determine whether a new parent-child center is to be authorized and whether an existing parent-child center shall be reauthorized. And now there's a new process, a new reauthorization process, whereby parent-child centers are reviewed for reauthorization every 6 years. The act directs the Secretary to disperse a joint allocation for all parent-child center services to the network, which in turn is required to distribute funding to each authorized parent-child centers. Prior to this, there were more individualized contracts with each center. So this is a more streamlined appropriation straight to the network. And lastly, this act requires the Parent-Child Center Network and authorized parent-child centers to provide any previously agreed upon information to enable the secretary to evaluate the services provided through grant funds, the effect of services on consumers, and the accounting and of the expenditure of grant funds.
Questions? I mean, we should stop after each bill. Questions? We'll dive more into parent-child centers. Maybe not, because we did quite a bit last year, but some of the parent-child centers have primary care are embedded within, or they're embedded within the primary care practice. So it's a nice opportunity for families to access primary care.
Do we know where they're located?
Yes, and we can get a map of location. We'll have the representative from the Parent-Child Center Network at some point, maybe coming into committee and sharing with us locations across the state. I forget Katie, how many, the 14, I'm trying to remember.
You're asking for the specific number? I can't tell you the specific number. 14 sounds about right to me, but I'm not sure if it's exactly 14.
Sure.
Just a curiosity, is there a nuance between the description parent-child center and child care center?
Yes.
And if so, what's that?
Katie, go for it.
Sure. So child care center refers to a center that's providing child care services, where you're dropping your child off and you're leaving to go to work or wherever for the day. A parent-child center may also have a child care center, but their primary focus is connecting families, particularly families with young children, to services that they may need, parenting coaching, providing a connection between a family and maybe public assistance programs, services like that.
Yeah, and the parent-child centers were first introduced in legislation. What I'm trying to remember, was it in the 90s or the 90s, I think. I know that Senator Munt was instrumental in working on that. I don't know exactly what. So this isn't a new organization that was put in place last year. Rather, it was sort of coordinating how they're overseen in their activities, bringing together. Okay.
Next was Act 186. This is another act that this committee spent a lot of time on, an act relating to the system of care for individuals with developmental disabilities. The first thing that the act did, there is an existing requirement to have a plan for individuals with developmental disabilities and their services. And this plan is supposed to be completed every 3 years by the Department of Disabilities, Aging, and Independent Living. At one point, I want to say within the past 10 years, there was legislation that some portions of the plan should be sort of pulled out and addressed separately through rulemaking. And this act undid that requirement. So now the plan is sort of treated more holistically, more comprehensively, without certain portions being pulled out and going separately through rulemaking. So that was the first change in this particular act. Secondly, this set up a process whereby the department would request an extension if their plan for individuals with developmental disabilities and related services, if it wasn't going to be completed on time in the 3-year time frame. So the act created a process to request that extension. Next, the act required Dale to submit a report on or before November 15th, so you've already received this report, regarding the oversight of services for individuals with developmental disabilities. It also requires that Dale submit a report on January 15th that includes an implementation plan addressing the fiscal and workforce requirements needed to conduct a minimum of at least one on-site annual quality assurance and improvement visit by Dale each year to the designated and specialized service provider agencies and other providers who are assisting people with developmental disabilities. There was also language in the act to create a limited service position of a residential program developer within Dale and allocate funds for this purpose, so that individual would help individuals with developmental disabilities and their families find residential placements, or also generate more housing options for this particular population. There is also a section that relates to pilot planning grants for residential services for individuals with developmental disabilities. So the Act directs Dale to develop these housing and residential service pilot planning grants in at least 3 regions of the state in partnership with the DAs and SSAs, designated agencies and specialized service agencies for individuals with developmental disabilities and their families. And there was also language in the act to address legislative input pertaining to a system-wide payment reform and conflict-free case management system impacting individuals with developmental disabilities. And I suspect that this committee will be hearing more about that as the House just passed out H1 yesterday, so it will be on its way to you next week to correct an error in this particular section of the bill.
Yes, sir.
Where can we find the report that was required to be submitted with the General Assembly?
Do we have that on our November 15th that came in?
You have that on the reports page, but also I'm happy you asked because we have a chart that we sent over to Alex this morning. It should be on your committee page. And it's a chart with all the reports due into your committee and the ones that have already been submitted. There's a hyperlink there, so it hopefully should be pretty easy to just click and pull up the report.
Thank you.
So any of the reports that we ask for and that come to our committee, then Alex will put them onto the report section, and then as we go through and as you go through, we'll go through them, but there are ones that you're going to be much more interested than others, and I really would help me to have you go through those and identify some areas that you'd like to include in discussion and in legislation. So we'll get to that.
So are there links ever attached to the agenda, or is that not done?
Unfortunately not.
Okay.
The best we can do is we can put something in there that you can copy and paste, but then it looks really
Yeah,
ugly.
no worries. I was just curious. It
Yeah.
seemed pretty formalized.
The best way to do it is just do the document section on the
Yeah.
information
Okay.
page.
Okay.
Yeah, so I'm going to just add one thing, then we'll move on to the last bill, but sometimes we'd have someone come in who's responsible for the report, or you see that it came from a specific agency like Dale. There might be an author of that report after we see it, and so you can look up the witness. It might be attached to that. Sometimes it is, sometimes it's not. So it takes a little digging, but the report should be right there. Okay, Katie, go ahead.
Okay, we'll move on to the last slide. So this was H728. You'll notice it does not have an act number because it did not become an act. This is a bill that moved through both the House and the Senate. It received final approval from the General Assembly, but it was ultimately vetoed by the governor. And if you're curious about the governor's veto address, I included a hyperlink at the very bottom of this slide, so you could look at that, what this bill would have done. So as you can see, it was an act relating to opioid overdose response services. It would have excluded harm reduction supplies from the definition of drug paraphernalia, so as to exclude the sale of harm reduction supplies to a minor from the existing penalty established in law. There was a reference to an AIDS service organization, a substance abuse treatment provider, or a licensed healthcare provider facility that would have been removed from statute. From the definition of an organized community-based needle exchange program. And the purpose of that was to expand the type of a provider that may provide access to clean needles and syringes. This act would have required the Agency of Human Services to provide Medicaid beneficiaries with medically necessary medication-assisted treatment for the treatment of opioid use disorder when prescribed by a healthcare professional practicing within the scope of the professional's license and participating in the Medicaid program. It would have required the agency upon approval of the Drug Utilization Review Board, to cover at least one medication in each therapeutic class for methadone, for buprenorphine, and for naltrexone, as listed on Medicaid's preferred drug list without requiring prior authorization. And those are all drugs that are associated with medication-assisted treatment for opioid use disorder. And then the act would have required reports from DVA on prior authorization for medication-assisted treatment in the Medicaid program. This is an ongoing report that has sunset, and the idea was to extend the due date of this particular report so that the General Assembly would continue to get information on that topic. And then lastly, the act would have established an overdose prevention site working group for the purpose of conducting an inventory of overdose prevention sites nationally, identifying the feasibility, liability, and cost of both publicly funded and privately funded overdose prevention sites, making recommendations on municipal and local actions necessary to implement overdose prevention sites, making recommendations on executive and legislative actions necessary to implement overdose prevention sites, if any, and lastly, developing an action plan for the design, facility fit up, and implementation of overdose prevention sites in Vermont. And again, that was vetoed, and you have the hyperlink at the bottom of the slide. So that is it for the bills that moved through this committee.
What is a facility fit up?
That is taking an existing facility and making the renovations necessary for it to be ready for the new purpose that it's intended to be used for.
Okay, thank you.
So it wasn't just the study, it was actually implementation and doing, and that's part of it. I believe that's part of the governor's veto message. Katie, is that last piece, the implementation piece?
I would have to pull it up. It's been a
Yeah,
while
I
since
just
I've
looked at
reviewed
it.
it.
I was trying to remember what the biggest concern was. I know the hub and spoke that we have in place through Blueprint, the hub and spoke system is significant for opioid overdose response, but also care. So that was also part of this message. And we'll get into some of this going forward. Go ahead.
Could you click on his veto message just so we can take just a glance at it?
I think you'll have to do that, Amron, if you're able.
Yes, I can.
It's there. It comes right
Let me
there.
see if it shows up for you. I might have to stop share and then reshare.
It popped right up on my iPad.
Can you see this?
No, you'll have to
Okay.
share and reshare.
Yeah.
It's fine, don't worry about it. I just thought if it was right
It-
there.
Martina, it's right, it comes right up. It's a short letter.
Okay, great, I can do it on my own. Oh,
There it is.
So let's see. So there's concern that it directs the administration to design a plan for the implementation of one or more overdose prevention sites, also known as safe injection sites. From my standpoint, it seems counterintuitive to divert resources from proven harm reduction strategies to plan injection sites without clear data on the effectiveness of this approach. Do you want me to continue reading it?
No, that's okay.
Okay.
Yeah, no. But that was a bill that was vetoed, and it did pass out of this committee. It also passed out of the House. That happens sometimes, and that's the way it is. And I don't think there was an interest in the override vote. I don't think we voted on it. No. Okay, thank you. So we've been through all of our bills. And we see the massive number of reports that are coming in as a result of our work, and we'll get to those. Do you want to spend, I was thinking, why don't we spend about 20 minutes, and we'll stop a little bit early, just getting started on the reports that we have in committee. So I'll leave it to you how you want to proceed on that.
Okay. Are you able to pull up that document, or would you like me to do that, Amron?
It looks like it's checked out to you still.
Okay, I
So
will
I can't get it.
It's under your name on our page. There we go.
Okay. I might just pull it up from the committee webpage anyway.
If you can share screen with us, because not everyone's looking at an iPad right now.
Sure. Yep, let me pull it up and I will share it with you. Okay. Are you able to see this document?
Yes, perfect.
Great.
A little bit bigger.
Bigger? Okay, let's see what
Yes,
I can do.
please, larger.
How does that work?
That's good. Thank you.
Okay. Okay. So Aaron and I are going to sort of walk you through some of these reports at an incredibly high level. You'll see there are 8 pages of reports here that are due into this committee. These reports are reports that began to come in after adjournment. So you'll see that we have some reports that were due July 1 that are referenced here. And we list reports that are due in the coming weeks and months, and we've highlighted a few at the very end that you might not expect during this session, but are reports that you're anticipating to come back to when you return next January. So the first you'll see is a report of the self-neglect working group. This focused on recommendations for adults who, due to physical or mental impairment or diminished capacity, are unable to perform essential self-care tasks. And this report came in July 1st of last year. There's also the Child Care and Early Childhood Education System Analysis. If you remember, yesterday we spent a bit of time talking about Act 45, the Child Care Bill, and there were a number of reports associated with that particular act. So this is one of the larger of the 2 large reports that were anticipated as a result of that piece of legislation. It was conducted by a consultant that was hired by Building Bright Futures, and it came in last July.
Next is the quarterly Choices for Care report. This is a report that is submitted quarterly, as it says, back in August. This is from the Department of Disabilities, Aging, and Independent Living. This is an ongoing report starting back in 2005. And then, as you can see on the left-hand side, it has been a report that has been extended over time. And then next we have the receipts, expenditures, and balances of the Health Information Technology Fund. This is from the Agency of Administration. It's an annual report, and it came in September.
Next is the General Assistance Annual Report. This is the annual report. It's been coming in and it details how general assistance funds are used and the populations serviced by general assistance program.
Next is costs and contract staffing for private non-medical institutions. This is a one-time report that came in September. This is from Act 185 of the 2022 session.
Can you tell us what non-medical institutions constitute private institutions are?
That's a good question. I would have to look. I'm not certain.
We'll as we look at the report, we'll get a sense of that.
Yes.
Right.
Next is the annual Build Back report. This is an annual report from the Green Mountain Care Board that outlines as you may or may not know yet, the Green Mountain Care Board is partially funded by state funds and then partially funded by billing back to insurers and hospitals for the regulatory work that the board does. So the annual Build Back report outlines how the bill back went for that year.
The next report is an annual report on the Choices for Care program. This comes from Dale, Choices for Care, referring to a program that provides opportunities for individuals to receive care where they want to, including in their home. There is language in statute about how savings in the program are calculated and how those savings should be allocated and reinvested. So this report deals with that topic.
Next is the Global Commitment Investment Report. This is an annual report from the Agency of Human Services. You are probably hearing over the next week a bit more introduction about the all-payer model and global commitment and the state's 1115 waiver relating to the state's Medicaid program. So this is an investment report that the agency submits each year to show where the investments made through this approval from the Centers for Medicare and Medicaid Services has gone.
Yesterday, we discussed Act 33. This was the act that created the Health Equity Advisory Commission. And we noted as we walked through that particular act that there were a number of reports that would be due into the committee. So this is one of those reports. It's recommendations from the commission on continuing education, particularly around cultural competency.
Sorry. Next is Pharmacy Best Practices and Cost Control Program Annual Report. This is a report from the Department of Vermont Health Access. It is an annual report. As you know, Medicaid is operated within the Department of Vermont Health Access, including all of the pharmacy administration for that program. So this annual report shows the best practices and cost control programs for pharmacy. Next is the Quarterly Choices for Care report. This is from the Department of Disabilities, Aging, and Independent Living. It is submitted quarterly. As you can see, it is a report that's gone back many years. You saw there's an earlier report, quarterly report towards the beginning of this list. And again, this is about the Choices for Care program and provides quarterly updates.
Next is the report broadcasting information on missing persons. We also discussed this yesterday. This is, we mentioned that we had a report coming in sort of akin to a silver alert, somebody who has Alzheimer's disease or a related condition where the person may have some form of dementia and the person disappears somewhere. And this report is asking DPS to come up with recommendations for a system for trying to quickly figure out where these individuals are and bring them to safety quickly. The next report is an annual report of the Child Fatality Review Team. This is an ongoing team within the health department, and the health department submits this every November. Next is a one-time report, oversight of services to individuals with developmental disabilities. This is a result of the work you did on Act 186 last year. And this looks at quality assurance review of home and community-based services for individuals with developmental disabilities. And it also pertains to on-site visits to ensure that individuals are receiving quality care.
Next is the Medicaid Program Enrollment and Expenditures Quarterly Report. This is mentioned earlier in the list from the September listing. For some reason, we were not able to find the September quarterly report, but we do have a link here if you want to take a look at what the December quarterly report looks back at. It's just looking at how many people are enrolled in the Medicaid program and what were the expenditures over the quarter. Next is the Prescription Drug Cost Transparency. This is a report that is from the Office of the Attorney General. It is a, this report was in an effort to try and pinpoint where prescription drugs increases are coming from and bringing greater transparency to the costs of prescription drugs.
Next is a report from DCF on proposed high-end system of care plan. This required DCF and the Department of Corrections to submit a plan to ensure the availability of secure placements and treatment for people who are over 18 years of age, but subject to the juvenile or youthful offender proceedings. Next is the Alzheimer's disease coordinator position. So this was requested from Act 113 that this committee worked on last year. And the act specifically asked the Department of Health and Dale to come up with a plan to fund a permanent position for an Alzheimer's disease coordinator. They've already submitted that, and I believe the recommendation is to put the coordinator position within the Agency of Human Services.
That we may see something in the budget. I'm not remembering something in the BAA, but
Next is the increasing appropriate residential treatment to children and youth enrolled in commercial health insurance. You may recall from our overview of bills from the last biennium, this is a report that's coming out of this one-time working group, the Insurance Parity in Residential Care for Children and Youth Working Group. It is a one-time report. We have not seen it yet. Actually, I was not able to find it. Sorry.
I don't remember whether we've got a request to extend the time frame. They have. I haven't seen it. Okay, go ahead.
Sorry, I didn't mean to cut you off. Next there, it's hard when you're on Zoom to see if folks are done speaking or not.
I'm just saying, I don't remember seeing the report either, and I don't remember giving extension, but that doesn't mean it didn't happen.
The next report is from the Emergency Medical Services Advisory Committee. This is an ongoing committee, and there's an annual report required every year. So this is the annual report from that particular group. There's also a group on substance misuse prevention oversight, an advisory council. This is an ongoing group, and they submit an annual report, which you have already received.
Next is a report from the Office of the Healthcare Advocate. This is an annual report, which just covers priorities and activities of the Office of Healthcare Advocate throughout the year. Next is notice of introduction of new high-cost prescription drugs. This is also from the Office of Attorney General. It is submitted quarterly, well, at least quarterly, and it is posted on the Attorney General's website. If you want to go, they have a page about prescription drug transparency, and so you can see it right there. And then also related to prescription drug costs, the next report is the impact of prescription drug costs on health insurance premiums. This is from the Green Mountain Care Board, and it's an annual report. The Green Mountain Care Board, as you may recall, is responsible for conducting insurance rate review for those insurance policies that fall under the state's regulatory authority, specifically looking at large group health insurance that are not employer-sponsored plans under ERISA, and also the small group and individual insurance plans that are on Vermont Health Connect.
Next, you have the report of the Advisory Council on Child Poverty and Strengthening Families. You'll note that this advisory committee did not meet in 2022, so you should not expect a report coming from that particular group. There is also an appropriation to expand high-quality mental health and substance use disorder treatment professionals. This is from the 2021 budget. There was 1.5 million of a remaining appropriation to AHS, and it was directed to be used to expand the supply of high quality mental health and substance use disorder treatment professionals who are serving the designated and specialized service agencies. We've already received that.
Katie and Amber, I'm going to interrupt you. And what I think what we'll do is, why don't we stop here with the reports, and then we'll come back to this another day. We've had a really big day. We need a break, and the break that we're going to take is to introduce folks from the Boys and Girls Club. And so before we do that, thank you for being here with us by Zoom, and we will we'll pick it up next time.
Sounds good. We'll see you next week.
Yeah, and I'm going to suggest to the committee that as you see topics coming up on the agenda, correlate with reports, just scroll through the reports, and I'll try to identify some, that are relevant. So for example, the prevention, when prevention folks come in, I think as early as next week, I remember my agenda, there's that prevention report from the Prevention Council. That'd be good just to scroll through and see what's there. Executive summary recommendations, always very helpful for our discussion. Questions? Okay, so welcome, Boys and Girls Club.
Hi.
It's a pleasure to have you here. I'm going to have the committee introduce themselves, then I'm going to have you share with us who you are, what you do, and maybe have some of these folks over here introduce themselves. That would be great.
Sounds
So start here with you, David. Go ahead.
Good morning, David Weeks, Senator from Rutland County.
Good morning, I'm Senator Rock Gulick, and I live in Burlington. It's really nice to see you today.
Hi again, I'm Ruth Hardy. It's nice to have you here.
I'm Terry Williams, Senator from Rutland, also.
And Jenny Lyons from Chittenden Southeast, and I'm very familiar with the Boys and Girls Club, but I think it would be great to hear from you. Introduce yourself and.
So,
Yeah. Let's just spend about 5 minutes, 6 minutes would be good. All right, with all, yeah.
so good morning, everyone. Thank you for having us. My name is Alicia Grangin, and I'm with the Boys and Girls Club of Greater Virgins. I've been with that program since April of 2022, and I brought along with me, introduce yourselves.
I'm Rylan Burnett, and I live in Waltham. I'm Keegan. Sorry. And I live in Virgins.
I'm Emerson, and I also live in Virgins.
Virgins is a neat place. So is Addison. All of those towns that you're talking about are awesome. Yeah.
So as here from 3 different areas in our state currently, we have 5 clubs throughout the state of Vermont, Burlington, Rutland, Montpelier, and also Brattleboro and the Virgins location. So I represent the greater Virgins area, which is Canton, Waltham, Addison, Harrisburg, and which one? Waltham as well. Yeah, Virgins. So those are the areas in which I represent. Last year, we represented 112 youth in our community. The majority of those come from Virgins, but we have also represented 3 others from out of county areas as well. I think it's important that we have after school programming for several reasons, not only because of the job, but at the same time, just being able to give youth that extra after hours care after school. We feed our youth a full meal at 3 o'clock on a daily basis each day that they come in. So we have a full menu. And then they get a snack at 5:20 as well, which is a balanced snack as well for them, just to start there. And then we also do programming for them, and we do an hour of movement. It's important for them to get exercise and get some outdoor time if at all possible. So we encourage an hour of movement. When it's raining outside, we find creative things like indoor golf. Set up a golf course indoors. They set up obstacle courses on top of that golf course. And we have just a lot of different things that we do to make it fun and engaging, but also encourage that movement piece as well. I'm sitting in the health and wellness piece. I think it's also important to know that we don't have any stipulations on who attends. It's important that all kids are able to come as they are, no matter what the disability is, no matter what the LGBTQ, whatever it is, we accept you as who you are and want you to come to the club at all times. It's open for you. That's your place, your special place to be, and always welcome. We've partnered with a lot of different agencies. CSAC is one of those in Addison County that we've partnered with when we have individuals that come in with mental health issues that may need an additional care person to kind of gain their way through the programming and be able to get to a place where they can be independent on their own, or at least accept redirection from staff. And that's been a critical piece that we've had as well, which has helped out tremendously. So it's the spill for us and the Boys and Girls Club as a whole.
Well, thank you. It was terrific. We will have questions. Just want to say that the after-school program has been such a significant improvement and a great initiative, and we've supported it in here. I know that the administration will be looking for some investment going forward, so we'll see what happens there.
Yeah.
Senator Williams.
Just what can we do for it?
You know, I would be in here on some extra lobbying type stuff, but that's not what I'm here for. So what I will ask is that you visit your clubs. You visit and see what's going on at the clubs, and just gather like the happiness that's going on there, the work that's being done there, and be able to fully appreciate just what we're doing after hours. Our program is completely free. So there's others throughout the state that charge a minimum fee or based on, you know, income type thing, but we're open to everybody regardless of income.
Thank you.
We have oh, sorry, go ahead.
No, go ahead, please.
We have a great Boys and Girls Club in Burlington. I'm assuming that if I wanted to go for a visit, they would appreciate a heads up ahead of time rather than a drop in. Yeah. Okay. I will send an email.
Is your program 5 days a week, 7 days a week?
It's the same school hours, so 5 days a week currently, and right after school generally. So we follow the school schedules.
Well, thank you. It's really great to see you again, and thanks for bringing the kids. You guys are being really patient back there. I appreciate it. And I just wanted to give another plug for Alicia and the great work that she does. She's an amazing director, and they have a beautiful spot that's walkable from the schools. And they also run really great summer programming. Alicia ran a leadership program for teenagers this past summer that was really great too.
Where are you located? With respect to the high school?
It's across the street from the high school.
It is,
and about
okay.
2 blocks behind it. So it gives you the opportunity to for the kids to walk there. So it's really a nice location. A lot of clubs struggle with buildings.
Yeah.
And we own our building as of last year, which is a bonus. And just the proximity there. And then we've also worked with the schools to make sure that kids get transportation to the club. So we're in a unique situation where currently all of our schools, districts in Addison, Canton, and Ferrisburg, they all go to the high school at one location. We service 4th through 12th grade. But yes, gives us that extra piece that I think that's
Thank you. I've visited our Boys and Girls Club in Burlington many times. I've driven by yours, I think, so maybe I'll stop in. I won't stop. I'll try it.
Be more than happy to.
All right, thank you. This is great. Thank you guys for being here.
Do you guys want to
enjoy your time?
Can I say anything?
They'd like to.
Any questions or want to say anything?
Not really.
Do you have fun?
Yes.
So that's a good thing to say.
It's a good place to just chill and hang out with friends.
Hey, we love to hear that. That's good. Do you have Wi-Fi there, or have to?
We have Wi-Fi.
Oh, you can't do without it.
Cannot go without Wi-Fi. One of the things that I think is paramount is that we're just not doing video games, and they're getting acclimated to my new piece on leadership on that. So awesome. We do 3:45 announcements, which is basically anything in the area that's going on as far as after school activities, things they can get involved in, whether it's with the Lions Club, any writing, any homework that you need to do. We offer the tutoring pieces for that. So then it goes into the hour of movement, and then by that time they're able to do
That's amazing.
the different things. So
You've got everything all organized there. Even the visit to the State House.
yeah, that we
These guys
have
are
to,
lucky.
and we have a new website up. So by all means, check out the website. It's very informative. We keep our newsletters up to date on a monthly basis. I think that's important to be able to say what we're doing and also document it. So that way people can see really what we're actually doing.
Thank
Safe
you for being
travels.
here.
Thank you so
Yeah.
much. I appreciate it.
Yeah.
You're
See you
right.
guys.
Yeah, the weather on this side is definitely a lot different than our.
Thank you so
area.
much.